Too late.
Aha, I'm gonna pop this on my Instagram real fast. I got it.
Shoot off my honey. That's what I'm talking.
The legal cannabis industry is projected to be worth $84 billion by 2028. But not everyone has equitable access to that wealth. Marijuana Matters is focused on removing barriers to entry. Marijuana Matters is focused on creating an equitable and responsible industry that centers the lived experiences of those disproportionately impacted by marijuana's criminalization. This work happens through three focus pillars: education, advocacy, and entrepreneurship. In partnership with community industry and government, we create solutions to mitigate collateral consequences of the war on drugs. We invite you to join the Marijuana Matters movement. The legal cannabis industry is projected to
Hello. Are we live? I think so. Hi, everyone. Thank you for joining us. My name is Courtney Davis, and I'm the Executive Director of Marijuana Matters. And this is our first Friday discussion as a part of our partnership with Rooted in Good through Curaleaf. And today we will be talking about cannabinoids and sickle cell disease. You all just may have joined us, but we did play a little bit of a video that talks about Marijuana Matters. We are a social enterprise organization that works to ensure that social equity is the cornerstone of the legalized industry. We do this work through education, advocacy, and entrepreneurship, and this is a part of our education series. We are going to talk about the therapeutic benefits of cannabis for sickle cell patients, the way that individuals can advocate for themselves, and also some of the disparities in medical research for individuals and people of color. We don't all know, but sickle cell is a disease that primarily affects African Americans. 1 out of 365 Black newborns are born with it. Demetrius is here as a patient, as a sickle cell individual that has sickle cell. I have the sickle cell trait, which we'll talk a little bit about later, but it is definitely something that if you are a person of color, you probably know someone, a close friend, or it is in your family. And so I wanted to introduce our guest. I will start with Rebecca. Please introduce yourself.
Hi, I'm Rebecca Abraham. I am a registered nurse. I've been a registered nurse for over 10 years. I have worked with many sickle cell patients, and I currently own Acute on Chronic. I am a cannabis nurse, and all we do is help people use cannabis for their symptom control. So sickle cell is one of those things where we get patients and we help them use cannabis guidance. It takes a couple of appointments. We have nurses, we have doctors that help people do that. And I'm happy to be here. So thank you for having me.
Thank you, Demetrius.
Hello, I'm Demetrius Wyant, also known as AR the Prophet, sickle cell advocate, patient. The soldier strong way, sickle cell soldier. So I'm blessed to be here. Thank you so much for having me. Living with sickle cell my whole life, and I'm my own doctor now. So shout out to all the doctors out there. Shout out to you, Miss Rebecca, and shout out to Courtney and sickle cell.
Thank you.
Absolutely.
Yes, thank you both for being here. It's also National Sickle Cell Awareness Month, so this conversation is just really timely. So thank you for being here on a Friday, taking an hour out of your day to talk about something that is near and dear to all of our hearts. First, I just wanted to talk about sickle cell. What is sickle cell what does it do to the body? And talk a little bit about what happens when you go through a crisis.
Absolutely. So, man, sickle cell is a genetic blood disorder. So it's from two parents. It's in the genes. You're born with it. It's in the DNA fibers. It's through blood. You can't. It's nothing you can catch. It's not contaminated. So, um, but what it is a chronic pain illness, and it the lack of oxygen that gives the blood cells give lack of oxygen to the body, which can cause a lot of chronic pain, and it can shut down the organs. So that's in a nutshell what sickle cell is. It's a blood disorder, and it's a chronic pain issue. Also, it's a chronic fatigue illness as well. So it's because we're always tired, because we're always tired because we have a low hemoglobin. The hemoglobin is the fetal hemoglobin that you're born with. It's always low because the oxygen in the body is not 100%. So it causes a lot of pain, causes a lot of mental issues, and that's sickle cell in the butt. It's a very painful illness.
Rebecca, did you want to add
Yeah.
in? Okay.
Yes. So after working with many patients throughout the course of my career who have sickle cell disease, it is extremely painful. There are often problems with oxygenation, and it's because the hemoglobin that carries the red blood cells and the red blood cells, the hemoglobin molecule that carries oxygen throughout our body are differently shaped. What that does is sometimes it occludes the pathway for the other cells carrying oxygen, so it could affect oxygenation. Folks with sickle cell disease are more at risks for things like stroke. Some of the treatments, like hydroxyurea, have side effects that include cancer. So there are a lot of things that come with this disease process. One of the main problems that folks with sickle cell disease have is really severe chronic pain.
Wow. And I believe the shape of is where the name comes from, because it's not a circle. It's kind of like the shape of a crescent or something.
Yeah, it's like crescent moons floating in your bloodstream. And so that could clog up a lot of things, to kind of put it pretty simply. What's really interesting about the sickle cell trait is it actually is something that evolutionary seems to happen to prevent malaria. So folks who carry this trait typically have genetic origins from the global south. That's why you mostly find it in the Black, Indigenous, and sometimes Latinx communities. And so that's why we need to raise awareness. It is one of the biggest causes of death in children, particularly in African nations. So we really have to do a better job of treating this disease process, researching it, and talking about it, because we could literally save millions of lives very quickly by addressing a lot of systemic issues globally.
Wow, that's really interesting. I did not know that tidbit about malaria.
Yeah.
That's interesting. And so, Rebecca, you mentioned something about clinical trials, research. We are here to talk about cannabinoids and how they could help with some of the issues and symptoms that a person has when they have sickle cell disease. Clinical trials are kind of one of the ways that researchers find out if new treatments or new drugs or any type of medical devices are safe and effective for people. What's going on with the cannabis industry, sickle cell disease research? Is there a cure for cannabis? I mean, is there a cure for sickle cell disease? And can you just kind of talk through some of those things that come up from the medical perspective when we're talking about how do we find a cure for sickle cell and find treatment for people living with this disease?
Yes, this is actually a great question. And while I do have notes on this, so I want to pull those up. But I want to kind of walk us all back to how research is done, mostly in the Western world, which kind of carries the rest of the world for research. And not necessarily because we're super smart or better than anybody else. It's because of systemic issues that kind of bucketed all the research to happen in Europe and the United States. It's kind of a predatory thing that the government does that prevents other nations from doing this research. But the main way we do research in the United States, and the way we find science in medicine, we only kind of stick to one type of science. Evidence-based practice is based off of something randomized controlled trials. So that's when you put a bunch of people in a trial, you have a placebo group, you have the group that's getting the new drug or treatment, you account for all variables, age, race, particular disease process, other variables. And then you isolate what works and what doesn't. That takes about 10 to 20 years if you're in a hurry. And then the evidence-based practice is based off of all of those, takes another 20 years to implement. So that's about 20 to 40 years of working on something to get an answer. The problem with this is evidence-based practice and randomized control trials exclude a heck of a lot of people. Most of these randomized control trials up until the last 20 years, and we're still pretty bad at it, mostly include cisgendered white males of Northern European descent between the ages of 18 and 55. So that's why things like sickle cell disease are really not researched, but it kind of goes beyond that, cancers, other things. So we have a big gap in care. As far as treatment, so there is currently no cure for sickle cell disease. There have been some really, really cool science coming out, but not many. Since 2017, there are only about 3 drugs that are being researched and looked at. These drugs are typically inaccessible to most of the population that has sickle cell disease, if not most of the population in North America in the first place. New drugs are patented, they're very expensive. This is another way where the systems are built kind of against the patients in general. The one treatment that we know helps with symptoms, hydroxyurea, most people, even though it is the most affordable out of the treatment modalities, there still is a large number of folks in the sickle cell population that can't access that either. And that is the one that comes with a ton of side effects. Stem cell transplants are starting to look good. There is some plasmapheresis. I know in Chicago, University of Illinois, Chicago started doing some research. There's some really excellent doctors there looking into it. But we have a really long way to go. And it's just because medicine hasn't, put a lot of effort. Unfortunately, I know I might get some angry tweets about this later, but it is what it is. The focus hasn't been on sickle cell disease as it should. It's a huge problem, much bigger than folks outside of the community really are willing to address. So we really should be spending a lot more time and energy on it.
Mm-hmm. Demetrius, have you ever been asked to be a part of a clinical trial for sickle cell disease?
Absolutely, I have, and I will start this off by saying, shout out to IGOs and Rise Up. They have a new campaign where they're doing clinical trials for people with sickle cell. RiseUpStudy.com. So check them out. IGOs, great group of people, and they're dedicated to change the narrative for the future of sickle cell. So absolutely, is there a cure for sickle cell? Absolutely. I believe the cure is right here in the mind, but you have to do the research. So that's what I always tell people. It's always about nutrition and food. Living in America, we've always learned that, the American diet is soul food, is the good stuff, fast food, everything that your taste buds like is always bad for you. You have to learn that in order to live a healthy life with sickle cell, we're not regular people. We can't depend on fast food and all of these high sugared foods and processed foods and all this stuff that's not hydrating the body. We already live with a deficiency of oxygen throughout the body, right? So we have to find foods that's going to hydrate the cells. Only way you do this is through nutrition and natural herbs, coconut water, alkaline water, and having a natural plant-based diet. You have to get away from certain meats and all of that. So there is a cure in sickle cell. And is that going to cure you completely of the disease? No, it's not. But what it's going to do is it's going to cure you from depending on pharmaceutical all the time. It's going to cure you of having to run to Western medicine and the hospital, the ER, every single time you feel pain, because it's going to lessen your pain crisis when you start eating healthy. The cure is in the food. Have to find a well-balanced diet that's high in hydration and nutrition. So that's the cure right there. Also, people always ask me, what do I take when it comes to medication? Because I've gotten away from the pharmaceutical companies. Now, for medication, I used to take a whole lot of medication. I was on 180 milligrams of narcotics, which is opioids, every single day. Dilaudid, morphine, everything, Demerol, Xanax, anything you could think of, I was on it. All top shelf narcotics. Now, the thing what that does is that's a chemical compound. It suppresses the mind and the body, so you're in a sedative state at all times. Now, the doctors, they're going to tell you that you need this for your pain and it's going to help chronic pain. But in another literal sense, they never tell you the educational piece behind it, the addiction part, which can be very addictive if you start to abuse it. And us naturally, we don't have no insight on this. We come to you because we have pain. So we start taking all this medication. It starts to hurt the body. Now I've weaned myself off 180 milligrams of opioids with cannabis, the use of concentrates, RSO, Rick Simpson oil, which I call now rare soldier oil, for my sickle cell soldiers. It's very good for nighttime doses, and it's going to help you get rid of that nighttime dependency of opioids, because we all go through a lot of insomnia where we can't sleep. We have to turn chemical compounds into natural herbs, which is the medicinal part of the plant. See, a lot of people don't understand that CBDs and cannabinoids that are inside of the plant is what helps the body to calm down. That's natural medicine. That's medicinal. That's what's going to replace the need of having to run to Xanax, when you have anxiety. CBD is good with that. For appetite, when you're nausea, a lot of us run to what is it? What's the nausea medicine?
Zofran, Compazine.
Yeah, help me out. It's been a little minute.
Okay.
We all go to that. So CBDs and 1-to-1s and tinctures and 1-to-3s and 1-to-4s.
Okay,
those are
Demetrius, you are spitting too much. So back you up 1 second before we get into that. I want you to talk about what goes through a crisis and why do you need the medicine, and then we can pivot. Cannabis can help with some of those symptoms that happen when you go through crisis. Because I know we're gonna get you're talking all this stuff, but I just want people to know we have a sickle cell crisis.
So when you're in a sickle cell crisis, here's the thing. When you're in a sickle cell crisis as a sickle cell patient, the first thing you do is run to the emergency room, right? First thing that they're going to do is they're going to administrate pain medicine for you. Right now, you're going to get on a regimen of pain medicine that's going to come to you every 3 to 4 hours, depending on the doctor, depending on your level of tolerance, depending on how much pain you're in. Okay? Now, what happens, what people don't understand with sickle cell, administrating medicine like that, yes, it does give pain relief, but there's also side effects within that type of medication being administered, because you're not just getting one set of medicine. You usually get Dilaudid on top of Benadryl. Then you get the Zofran for the nausea. So it's that 3 right there. That's called a cocktail, and that's enough to knock any human being out. But what happens is when you're in a real sickle cell pain crisis and that one dose is not enough, they administrate you to that around the clock. So now you're admitted into the hospital. You're no longer in the emergency room. You're admitted into the hospital. You're a patient. Now it just depends on your body and how much you need and how severe the sickle cell crisis is and where your levels are on how long you're going to be there receiving that type of medicine. What they don't educate us on is, if you have a real sickle cell crisis and you're in the hospital for a week, say I've been in here for 5 days straight and I've been getting Dilaudid, Benadryl, Zofran all around the clock every 4 hours, you do the math. That's so much medication that my body is now dependent on for healing when I get discharged from this hospital. I don't have those medications. I do, but they're in a pill form. It's not the same thing. The body is naturally going to go through withdrawal effects, okay, from all of these harsh medicines that it's been pumped with around the clock. When I did not have cannabis, I would go through so many withdrawal effects being discharged as a patient. I would go through cold sweats, sweating at night, all the medicine coming up out of my body. I would go through I would have no appetite. I couldn't eat nothing for at least a week. Okay, I'm throwing up everything. The medicine's coming out of my system both ways, through my mouth and through my, it's like discharging literally throughout my pores, throughout waste and everything. So what happens when you have marijuana on? When I had marijuana on hand and I would smoke after discharge, I wouldn't have those problems, because what's happening now is I'm replacing the chemical that was given to me in the hospital. I'm now replacing it with natural medicinal that's helping with my appetite. My nausea is not there. I'm not throwing up no more. All because I took a couple points. I don't have to smoke a whole joint. And here's the thing for my people that are like, oh man, I can't smoke. I got tinctures. You use tinctures. You use things like concentrates. You use topicals. You make tea. You know, you put these in your food. Like, you have to learn. You got to get creative with it, because there's really not a handbook on how to use it. If you know you can't smoke, if you have acute problems, which I know a lot of my sickle cell patients do, you can't smoke it. There's other ways to use it. But back to when you're getting discharged from the hospital, if you have this plant, you're not going to go through so many cold sweats. You're not going to go have the withdrawal effects that you wouldn't have if you did not have the cannabis. So there's a fine line that the natural plant plays in the body, because the body naturally has cannabinoids in it. Okay, we have cannabinoid receptors that are built into our whole body. It's in our fibers. Okay, so it's like, imagine going all these years and you don't have, you have cannabinoid receptors in your body, but you're not giving it what it needs. You're not putting the cannabis in it that needs to thrive. That's how I had to look at it. So imagine eating, right? And getting fat from the food, but not getting the feeling from it. That's the same thing. So you have these receptors in the body that need cannabis. So you put it in it and it receives it how it goes. So it's processed through the endocannabinoid system. And what it does is it tells the body, okay, I need healing in this place, that place. Same thing with the chemical compound does. And it does what it needs to do. A lot of us, we don't have the education on that. So you have to dig deep, and you have to have talks like this that's going to allow people to know, what? I have cannabinoid system built in my body? Yes, you do. Because we are a living plant. We are literally a living plant.
I'm nodding aggressively because everything you said, the science is 100% correct. We do make our own endocannabinoids. We have receptors. What makes cannabis much, 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 much safer than opioids, or at least a good partner to opioids, because there are some people who are going to have pain in different times. And I have absolutely seen folks wean themselves from opioids with cannabis. So it's absolutely possible. But because cannabis really, everybody is really pretty special. I know as a millennial, we were all told we were special, but no, really in cannabis, we are like really special because, what each of us would take if we all broke our arm for our cannabis dosing would be extraordinarily different. So many people can wean off opioids. There's going to be some people who need both or other things, and that's fine. What happens when we get sick, viruses, trauma, age, sometimes we burn out our endocannabinoid receptors, is we do stop making, this is the hypothesis, we stop making endocannabinoids in our system. So the plant fills those receptors up, and that happens over time. So the biggest misconception about cannabis is it works immediately. No, it actually takes somewhere between 14, 60, 90 days once you find your correct dosing for it actually to start working. And then what I've been seeing in our work, we have about over 400 patients of data that we go through, is we sometimes see this happen in 3 steps. We see with THC is where you get kind of your most immediate effects. So people feel immediate relief. Some people from CBD, CBG, then your CBD, your CBDA oftentimes takes effect in 14, 30, 60 days. Those are your other cannabinoids, the CBDs, the CBGs. So I always tell people be patient with those. And so that's the second wave. And then sometimes, which really cool, is we start seeing a third wave of pain control or symptom relief that happens often weeks. The most distance I've seen between initial and initiation of cannabis and complete relief is about 9 months. We took care of a chronic pain patient where they had those 2 parts. They had immediate relief, then they had a secondary relief within a couple weeks, and then 9 months later, their pain was a 2 out of 10. So know that it comes in waves. And I was going on about what makes cannabis so safe in conjunction with opioids or even alone. Opioid side effects, death. Why? Respiratory depression. And it is not at the fault of the patient. So like I'm seeing some of the comments, it builds up in your system. It takes with opioids more and more and more and more and more opioids to get pain relief. But if you overshoot that dose as a prescriber, you could cause somebody respiratory distress if they're not near something called Narcan, the reversal agent. That's it. They could die. It's really terrible. Why do they die from opioids? Opioid receptors are in our brainstem. Our brainstem controls our breathing and our heart. We have endocannabinoid receptors, just like Demetrius said, everywhere in our body, except our brainstem. So it's a really cool, natural kind of protective mechanism. I often joke, you could go to the dispensary and eat and drink and smoke everything in there. You won't die. You will feel really uncomfortable, but you won't die. And that's a fantastic mechanism and why cannabis should be implemented more. And something I do, our nurses and physicians, you can't work in cannabis as a medicine or, what do we have to say? A supplement, right? Or a plant-based botanical food replacement, whatever euphemisms we have to use, without being an advocate. So something we're constantly trying to do is constantly trying to talk to doctors and hospitals about how they could start using CBD or cannabis, at least on the outpatient side, to probably reduce admissions, decrease lengths of stay, things that would really help people and help wean them off the opioids, or at least give somebody a supplement to opioids. And we could talk, I think we're going to get into more of like what the opioid crisis has to do with sickle cell and kind of how both parts of that are extremely harmful to the community. But yes, we have this really cool system. The plants help, but what works for everyone is going to be extremely different.
Yeah, that is definitely true. And I think having these conversations because it gives folks an idea of what they could start, or maybe you may have already been curious about trying cannabis because a couple of years ago there was a bunch of buzz because there was a clinical research trial that found and significantly improved mood compared to the placebo. And so about how it can help your physical pain, but let's talk a little bit about emotionally. Demetrius, you touched on this earlier, the cost and state of, and how you didn't use the word depressed, but it's like you're almost like a zombie or something because of
you're on
in
a
a fog.
sedative state. Yeah, you're always in a fog.
How can cannabis help your mood?
Oh man, cannabis, especially a sativa. A good sativa can definitely brighten up your mood. It can turn everything around. And it's just its job. We all got jobs, and cannabis's job is to uplift you. You're supposed to be happy. You're not supposed to be down. So what cannabis does is it's definitely a mood lifter, but you have to find there's strains, what I'm saying? There's certain strains that you use. that are going to help with this. Like, you don't want to, if you're down and, you know, and you have a mental problem right now that you're going through and you don't want to think about too much, you probably don't want to be on any type of indicas at that point. You know, you want to keep it uplifting and light. And so you get on sativas, and then, you know, you just have to find, everybody has to find what works for their body, because cannabis is experimental. You have to see what works with you. You know, just like opioids, every opioid is not going to work for you. Like Dilaudid doesn't work for every single one person. But what you have to understand is you got to experiment the same way you experiment with pharmaceuticals. That's what I always tell my patients. They're like, man, does cannabis really help you? Like, for real, like, is it really taking the pain away, bro? I have sickle cell SS. Yes, sir, it is. I've battled with so much pain. I've had surgeries on top of surgeries. I'm right now I'm going through a vascular necrosis. Like, what people don't understand is with your bone, you start losing bone density and your bone starts to die off. And it's called AVN, a vascular necrosis. Very painful, very, very painful. I've known patients at as young as 25 that had to have shoulder and hip replacements. You know, so just the trauma, just the effect on the mental that has. Cannabis will definitely help that. It's gave me a mindset to keep going. You know, when I'm taking opioids, I'm in a depressed state. The side effects with opioids is stress, depression. You know what I'm saying? So like, you have all of these mental issues, these mental blocks that are, you know, these unclarities that are keeping you in a fog, literally. So you don't really get to search for your soul. You don't get to find out who you are. But when you ingest the cannabis, that plant inside you, you start digging into yourself. You start to understand, okay, I can heal myself. I do feel better. Talks of affirmation you start having with yourself, and these things help. Now, when you on opioids, you're not, you know, you just accept that I'm sick, you know, like that's the trick of the enemy. You know what I'm saying? Here, take this, it's gonna help you. In all actuality, you gotta look for alternatives. You know, there's always something natural and safer. And that's what cannabis is. And that's why we're having this talk, because the effects that I've had from opioid abuse and dependency is what played parts on my mental. You have people that are young as 18 that have suicidal thoughts. You know, I talk to young men who in support groups who have suicidal thoughts, and they haven't even reached 21 yet because of all of this stuff that they're going through with sickle cell pain. You know, they can't be there for their loved ones. They're missing out on birthdays. You get to missing out on holidays. You're in the hospital dealing with pain, a sickness. You start to look at your life like, is this really life? Is this really what I'm here for? I'm here to tell you, man, yes, you got to escape those type of thoughts. So that's just a chemical. That's why they call it a chemical imbalance. The body is not supposed to thrive off that much chemical compound. We're not made up of that. You know what I'm saying? So when you ingest cannabis, that natural in you, you start to understand, you know, the body starts healing itself. Literally, you have to put the body in healing. The body heals itself when you put it in the right conditions. Put cannabis in the body when it's sick, when you're hurting, when your mental is messed up, and you will start to see the effects. You put the chemical inside your body, you also see the effects. People, a lot of my people with sickle cell, they tell me, bro, I'm tired. I'm ready to make the change. I'm ready to do it. Tell me what I need to do. You need to start slow and you need to start small. Start with CBD. See how CBD work for you. Because what people don't understand is ibuprofen, 800 milligram ibuprofen, you could take that and leave that alone and start taking CBD, CBG, CBN. Now you're getting the same, because it's
let's talk a little bit
anti.
about some of those different ones.
What sickle cell is, what a lot of things is with the body with sickle cell is we have a lot of pain, and all this crisis come from inflammation. The inflammation comes from the food that we put inside our body. So we have inflammation, which causes us pain in certain areas. So once you ibuprofen is what we use to treat inflammation with sickle cell. That's what the doctors give us. But in my research, learning to use the plant and get away from pharmaceuticals and do more natural, I'm learning that CBD is an anti-inflammatory. It does the same thing. I no longer need naproxen, ibuprofen. I don't need these things, Advil, I don't need that, because I'm now using CBD as my anti-inflammatory.
Yep.
So you Am
I
I right?
I can agree. CBD in studies, THC, CBG is kind of the newest one. A little less studied, but we're finding is very, very effective for a lot of things. Yes, they are all potent anti-inflammatories. They work the same, if not better, than ibuprofen. And when we compare cannabis to ibuprofen or naproxen or Celebrex, cannabis works on the same pathway. I have a very boring drawing that I won't show you. Why cannabis is better in CBD, side effects. So if you're taking 800 milligrams of ibuprofen, couple of weeks, 15 days out of a month for 20 years, that's going to mess some stuff up. Side
Yeah.
effects of ibuprofen, that's not talked about. Higher risk of heart attack and stroke. Bleeds in your stomach, which can be slow or fast. Kidney failure, and especially so. Go back to how I talked about how we have really bad research problems for anybody who is not a middle-aged white man, essentially. When we look at medications in the Black community and how effective they are, right? We don't really have hypertension, right? We see agents we give for blood pressure that just don't work as effectively. And it's probably because of the gap in research. So the Black community is already at a much higher risk for renal failure. And we see that in the numbers, and we see that in the data. And it's due to systemic racism and implicit bias in healthcare and how oftentimes things are mismanaged, but also the gap in research. So nobody needs any extra risk factors of 800 milligrams all the time of ibuprofen to add to that risk of renal failure, because it's one of the top 3 side effects of ibuprofen. And it's a very good anti-inflammatory.
I'm so glad you said that, because here what a lot of my sickle cell family, they want to get away from the opioids. So they say, yeah, man, I ain't been taking the oxy like that, but I'm taking the ibuprofen in place of my pain. And I say, yeah, that's all fine and dandy, but you want to start getting away from that as well. And they're like, well, how am I going to do that? Cannabis. And a lot of them like, bro, I just cannot smoke. I cannot smoke. And here's the thing. So I would love to talk about like how people can get. I know this is on the agenda. I don't mean to be jumping in front of
No,
kind of like we right into that. I'm sorry, but
I am here to manage a conversation that is flowing.
What happens is,
and if that's what we're doing,
the biggest question I get is the thing is cannabis is not so easily accessed to all patients with sickle cell. That's the biggest problem. You know what I'm saying? So if you have, I'm in Florida, and I just so happened to move when it hit the ballot. I voted for it, and it was here, and I was one of the first sickle cell patients with the card. That wasn't my doing. That was all faith and favor aligning up for me. But that's not the case for every sickle cell patient. Every sickle cell patient in other states that is illegal. We got Georgia, still illegal. We got, spots in the Midwest, up north, down south, still illegal. And they're like, man, I can't get my hands on no RSO. I can't get my hands on no tinctures. How am I supposed to get concentrates and all of this, the stuff that you're using?
So how do we get this to the people who need it?
They need it.
This is my passion project. So what I didn't mention in my bio is I started my business because I worked at academic medical centers for over 10 years, mostly in the ICU. My husband is also a hospital medicine doctor. So hospital medicine doctors treat sickle cell patients all the time. I've never mentioned this before, but one of the things that made me fall in love with this man instantly is, doctors are fast in the hospital. And I talked about it when I first met everybody, but there is a lot of systemic racism and bias in the medical community and nursing community with sickle cell patients. And it's because, in my experience, I was not taught about sickle cell in nursing school, and I went to nursing school on the south side of Chicago. So how did that chapter get missed, right? But you walk into work And boom, like lots of sickle cell patients. And typically, nursing's origins, we did a lot of great things, but we did not come from a perfect place. We have a lot of work to do that needs to be done. And sometimes if you are a new baby nurse and you are trained by an older nurse, they give you their baggage, which is not good. We have to work on how we treat people with chronic pain in general in this country and mental illness. And when you are hospitalized as a child over and over and over again, that's extremely traumatizing, and it does change your brain chemistry. We need to teach nurses to be more empathetic and to not judge people when they have pain. I don't know who taught nurses to start putting value judgments when people complain of pain, but we need to go the opposite direction. So unfortunately, medicine can get this way too. Like you get the wrong mentor and you're given poor messaging. And so I happened to work with a bunch of good doctors, but when I met my husband, he did residency in Chicago and then worked at a Chicago hospital with me. And all of the sickle cell patients knew him from his residency and from his current job, and they loved him, and he would sit with them and he would talk to them for a long time. And so we need more of that. So I started this business because him and I would talk. We would get questions all the time from patients, sickle cell patients, people with chronic pain. They would ask him, they'd be like, "Hey doc, how do I get this cannabis? How do I use it?" And he would be like, "Oh, I don't want to answer you. I want to, but I don't want to get fired." And so we see that. And so we were talking, and I got a certification in cannabis nursing, and I've always wanted to do patient advocacy. And I said, "Hey, I got the certification. What do I do with it?" And he said, "You need to start a business, because I can't tell you how many times we're asked." And we named off all the populations, and sickle cell was one of them. He's like, "I get asked, I want to tell people something. I don't know where to send them. I want to talk to my colleagues, but like, I don't want my employer to get mad at me." And so that was how the company was created. So now, I put this out there. If, you have a physician and you don't want to talk to them about medical cannabis, and when I study chronic pain is a multifaceted thing, even beyond the disease process. And to fix it, it takes plant-based medicine, pharmaceuticals, a healthy diet, mental health support, exercise support, physical therapy. There's a whole lot of things, people aren't getting or have access to. So what you can do, and in this study, I found out that who doesn't use medical cannabis? Majority of Black men do not use medical cannabis, even in legal states that are recreational and medicinal. This makes sense if you know the history of the last 30 years, as the war on drugs just did horrific things to Black men. So of course there is fear. So how do we stop that fear? How do we get this access? Talk to your doctor. And if you don't want to, we will. I educate everyone's doctor for free. I will call them. I will give them free education. I will make them not fear this plant. I will do my best to kind of undo their brains with the 75 years of stigma that we have. So we are always, 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 always happy to talk to your doctors. And that's what we do. And we're always trying to push ahead. So like, follow us, drop our name, call your doctor, be like, "Hey, cannabis is medicine. Like, call these nurses and doctors. Like, they'll talk to you." So we could even do it if you don't have to, because I get it. Like, there is a lot of fear. But this could truly, truly help people. And then we also need to give people access to these other things too. So know that it's a lot bigger than just one modality. So
being your own advocate is really, really challenging. And one of the things that we hear a lot about, I'm a Black woman. I recently had a child last year, about the way that Black women, maternal rate of death during childbirth. And I found out that there was a 2000 that medical professionals are more likely to undertreat pain. And so we talked a little bit about the racial biases that exist in pain assessments and the treatment. And as a sickle cell patient coming in over and over again saying, and then, we didn't talk about this, but I kind of wanted to pivot here, that patients are treated differently when they start off. As I said, this is something you're born with. Initially, you're seen as a child. You're in children's hospital. They're bringing by teddy bears every Christmas that you're there, or whatever. But what happens when you become an adult, and how do you continue to, when we already know these implicit biases exist, we know that we don't really like the cop, understanding that there's another alternative, cannabis, that's something that we need people to understand and figure out how to access.
All right,
I said a lot.
Let me paint a picture for the listeners. So imagine, I call it precious pediatrics. That's what we are. Precious pediatrics. They don't want to hear you crying in pain. They don't want to see you in agony. They don't want none of that for you. So they treat you with so much love and tender love and careness as you're a child with pediatrics. As you grow up, as you grow older, I was 15 when I got transferred from pediatrics to adult care, all because of priapism. Now, priapism is a form of sickle cell that happens in men that, a lot of people don't know about, that a lot of people don't even talk about. Now, what happened was at 15, me being from the Midwest, Des Moines, Iowa, these doctors weren't educated because they weren't educated and they didn't know how to treat me as a child. They thought that I should see an adult urologist at the age of 15 that can help me with priapism. See, here's the thing. You get so much comprehensive care as a child, as a pediatric. You got your heart doctor, your lung doctor, your urologist, your primary care, and your specialist all in one. But when you become an adult, you have to go find all of these people on your own. And they all drop the ball because none of them are educated. And not that they're not educated, they don't take time to understand that sickle cell is not a one-size-fits-all disease. That's our biggest problem. They think, okay, I did this for Thomas, it's going to work for Demetrius. That's not the case. We all delicately different in our DNA, and that's what sickle cell is, and that's how it needs to be treated. So what happens when we precious pediatrics, they love on us, they care for us, not knowing that same child that got that same condition that he was born with going to live up to be an adult, and he going to have them same issues that was cared for as a child. Now, where the ball gets dropped in transition, I'm not sure. But we need to have more workshops. We need to have more conversations. There needs to be a transition phase for children who are 17, 18. At 17 and 18, you need to start having workshops to know that you're about to go into adult care. You need to start learning how to look for doctors, talk to doctors. You need to know about your sickness to where you can articulate it to medical professionals at the age of 17. But this is not what we have. We don't have groups. We don't have organizations that's formed to do this. And this is where the funding and all of that, the problem is we don't have no funding. We can't go inside the schools and we can't talk about sickle cell. There's no funding there. It's not in the agenda. We can't go inside the hospital and talk about sickle cell. It's no money there. It's not in the agenda.
Yeah, and why is there no money? I saw a question, who is dropping the ball here? So unfortunately, in the last 30 to 50 years, the way we fund medical research has drastically changed. It's all the pharmaceutical companies. The pharmaceutical companies care about how to make a profit, right? Because if it was about healing people, if it was about getting medicine access to everyone, we would have more research for sickle cell disease. We would be educated on it. More doctors and nurses would be more properly educated about it. This also ties into chronic pain. Chronic pain, there's not a lot of money to be made in chronic pain, except the Sacklers with the opioid crisis sure tried to figure it out by killing a lot of people, right?
Yes.
Pharmaceutical companies drive the bus on who gets money and who doesn't. There's a little bit of public funds to go around, but not that much. So that's really the problem. They want to hold on to patents. That's why we don't see the global South getting access to any medications really ever, even vaccines. Part of the reason why COVID was so rampant globally is because of this same problem. Same thing happened with HIV. They had the science, they had the technology, and then they told everyone in the global South, where we know the economies are different for a variety of reasons that are mostly the West's fault. And they said, but you have to pay for them. And countries in the global South said, we don't have that. And the pharmaceutical company said, well, that's just too bad. That's actually how we got the various strains of COVID. It wasn't people not vaccinating. It was literally the withholding of vaccines from places in the global South. HIV, same thing. You see it just decimating populations. Pharmaceutical companies with AZT didn't care. And when countries in the global South try to make their own, when they figure out the formula, there are economic sanctions that come from the government. Why would that be? Pharmaceutical companies have the most money in lobbying and politics. So that's why we're seeing no attention paid to sickle cell disease. That's part of the reason why we see, certain populations from certain countries not getting access to things. It's really, really horrible. I could talk forever about it, but we have to get more funding. At the end of the day, it's about the politics, and we really have to take money out of politics, because this cannot stand. It cannot go on like this,
Yeah, I actually read something today or yesterday, and it said that every time a state legalizes cannabis, the pharmaceutical industry loses like $100 million or $1 billion or something. So if we really think about the shift that we're trying to make in the way that we take care of ourselves, the way that we educate each other's, we're helping people get out of prison. We're hoping that this industry could provide jobs, opportunities for people to be entrepreneurs, opportunities for people to feel better physically and emotionally. Legalizing cannabis and increasing access for medical use has just a domino effect and impact on our country and on the world, actually. I don't want to get too far down that rabbit hole, but I did have to say that since we were talking about pharmaceutical industries.
And I do, since you said that, I just want to say that cannabis has changed my life. It has got me off of pharmaceuticals, a year of dependency of pharmaceuticals and opioids. So cannabis can help, definitely, most definitely. It does. It changes the narrative. And we definitely do need, we definitely need, I can help my people here in Florida. So all my sickle cell soldiers, I got you here in Florida. But outside the states, tap in with my family that's on the screen. Absolutely. And we definitely gonna push the narrative so we could change the narrative for us when it comes to getting natural medications that we need.
Yeah. I see a comment, keep us sick and they get a customer. The mentality is ridiculous. Yes. American healthcare. There's a really great movie, Fire Escape. American healthcare, we are great at keeping people alive. We can keep you alive forever. We are bad at healing people. We'll keep you alive, but we can't make you better. And so that's where things like cannabis, the endocannabinoid system, using botanicals, those are things that, we still need a ton of research, but they do seem to be helpers to the body, very little side effects, help with pain. Yeah. When states legalize cannabis, you see the amount of opioid use drop. You see the use of pharmaceuticals drop. You see the folks in jail, crimes drop. Yep. Who were the people that are really interesting? Remember, This Is Your Brain on Drugs from the 90s. I just aged myself. That was made by the Centers for a Drug-Free Alliance. Who would that be? A pharmaceutical company, the tobacco company, and the alcohol company. And I'm sure somebody from the private prison company had a hand in there too. Those were the people lobbying against cannabis. Cannabis has medical cannabis has a 94% approval rating, bipartisan, in every state. Now, if you're a legislator, that's some easy votes to get your constituents
absolutely
to like you. Why wouldn't they do that? because the pharmaceutical money is too much and they get more from them than they ever will from the constituents. And because money wins elections, unfortunately, no one cares to legalize cannabis.
Yeah. I wanted to stay on this kind of narrative about opioids because we talked a little bit earlier about the epidemic, the opioid epidemic. You hear about it. West Virginia, probably one of the worst states, but it really had an impact on the country and have now been harder to prescribe. And we talked a little bit about different modalities, but can you talk about how withholding pain medication for sickle cell patients, like how does this tie into the opioid epidemic and the way that we should be talking about cannabis?
Yeah. So, like Demetria said, as a child, you get diagnosed with sickle cell disease, and it's, you're getting great care, right? Opioids, opioids, opioids. Now, I always say nobody goes into medicine or nursing to harm people. We all start out with good intentions, a majority of us. What happens is the way our healthcare system is built, again, based on profit, encounters are short and quick. So you're getting medications, nurses are in a hurry, no one has time to explain anything. On our side, we're getting burnt out fast. We want to help people, but the people at the top are like, no, rush, rush, rush your encounter. So we're giving things to people. There's no explanation. We gave opioids, no explanation. And there's a misconception that people who are addicted to opioids, it's a fault of their own, but it isn't. These were people who had chronic pain. If you remember 20 years ago, they used to give these things out like candy. You had a toothache, here's a 30-day supply. Now it's gone completely the other way, where your arm could be sawed off and they'll be like, well, maybe I can give you one Norco. I don't know. For folks in the sickle cell community, they absolutely had a need for opioids. There's no doubt about it. The pain is extreme. And so even in the heyday of opioids, when it was raining Oxycontin on everybody for anything, pain medicine was still being withheld from the sickle cell community. Patients were called drug seekers. How could this person be on 10 milligrams of Dilaudid? The whole thing. And now that it's swung to, we can't give opioids for anything. Doctors are terrified. The CDC has a count. In 2016, there was a recommendation. 2022, that recommendation in May just got even tighter. Now we're withholding opioids even more from people who truly need them, people who did not ever ask to become addicted to them. So now we're leaving people in severe pain. And yeah, people kill themselves from severe pain. It literally changes your brain if you stay in pain for that long. So fine, opioids are not great. Why don't we have treatments for sickle cell? It's because thanks to people like the Sacklers, it's a lot more profitable to keep tossing opioids at people and keeping them at home sick than it is to find a cure, because a cure, that doesn't keep customers. You want people at home sick. But so if we're going to decrease opioids, we still have to treat people's pain. And that's where cannabis should come in, because you cannot withhold pain medication. Like, you have to give people something. So it really can damage lives. It could make you sicker. It ruins people's income. It financially harms them. Like, it affects family, socialization, work. It's a whole mess. Sorry, I get really passionate about that.
Yeah, me too. I'm glad you do, because I share the same passion. It runs deep. Just know that it reminds me of a movie, a Hulu episode series that I watched called Dope Sick, and it's exactly what goes on. So let me tell you what happened. And just paint the picture, the whole narrative, so you can hear it firsthand. So when the war on drugs was happening, I was battling priapism at its highest peak in my life. And all of a sudden, I have to go to the emergency room every single night to get pain medicine, just so I could get this problem to help. You know what I'm saying? So when it was time for me to go to the pharmacy and fill medications, I don't have that. I can't get that. I can't administrate that. There was times that I went months and months and months without the medication that I need to treat my chronic pain. So now just imagine, like you said, people kill themselves when they're in that much of pain. I was in so much pain with priapism that I wanted to chop off my private part, literally. Like, that's where my mind was. That's where my mental was. And I'm dead serious. I can't tell you no lies. But I got to paint the narrative because I know people that really go through this. You know, like, it's real when you withhold medication that we don't have no control. We didn't ask to have this pain. I didn't wake up wanting to be in pain. So when I can't get what I need to help the pain, it's a big problem. And that's what hurts the mental. So this is why I tell people, when I step back and look at my life, man, I really struggled and I really suffered with sickle cell. And it was only because the lack of education and the people that I trusted with my life in their hands, they let me down, and they never steered me in the right direction to lead me on a healthy life, knowing that I was already on a damaged life when it came to sickle cell. My whole life I'm running back and forth to the ER. I can't get the medications. I gotta fake pretend and put on cries and yell out and scream out for you to even take me serious that I'm in the max pain that I'm in, and you won't even give me a milligram of pain medicine. You see, we have to, and that's the problem where so many of us die so young in the hospital, because it's the stress levels. Our heart can't take that. You feel me? Like, there's no way I should be at max pain and advocating for myself at the same time. There's no way I should be doing that in an emergency setting. You should understand that sickle cell is very real and precious. And if I don't act within this patient, he could lose his life, because it's his blood that's in effect right now. It's his organs that's in effect right now. But the ball's being dropped, and a lot of us are dying before we can even reach our full potential, before we can even understand a healing lifestyle. Because we have to fight for ourselves so much in a hospital setting. There's nobody to fight for us. And this is what I always tell my people with sickle cell. You have to learn how to become your own doctor. Yes, when you sit back and think about it, it's hard. It's one of the most hardest things to do. But that's life, okay? You got to get into a routine where you have to trust yourself. We've been in such a routine with these pharmaceuticals and these hospitals and these doctors that everything they give us, we take it. The doctor told me to take this twice a day and it's going to help my pain. Yeah, okay. But how do you feel? You look at your mental. You always crazy. You can't keep a full conversation. So you have to start being your own doctor and stepping away from that slowly. It's going to take, because we've been on it for years in and years in and years in. Most of my people that's 25, 30 plus, we've already drowned ourselves our whole life inside of sickness, inside of misery, inside of hurt, agony, doctors, trusting people that let us down with this sickness. And it's a weight on us. And it's hard to come up out of that weight. I could cry tears right now for my people right now because I know what they feel. It's a weight.
I can feel it. I could feel the passion. And
it's hard, and people don't know how to climb up out of it because they're so sick. You feel me? And all that they want to know is how can I help myself? And I'm here to let you know that cannabis can help you. And it's not going to be instantaneous. Nothing in life is instantaneous. You have years of bruised body. We have years of this. It's damaged. Our bodies are damaged. Our skeletal makeup is damaged. Our organs, they're damaged. You feel me? Like, we've had so much medicine in us. Everything that they told us, that ain't working here. Take this. This should help you. Okay, that ain't working no more. Let me up the dose on that. Our bodies are tired. When it comes, I go to pharmaceutical companies and they talk to me and they say, how can we help patients with sickle cell? I said, we're tired. You have to meet us at our needs. You have to meet us right here where we are. How are you going to help us? Cannabis is the number one thing that I tell people to get on. That's what you got to start first, because the pain and the agony that's what's going to help it. Cannabis, that's going to start shredding at that. You're going to start to get a little better thinking clarity. You know, you're going to start putting down, I haven't took this in about a week. Okay, bet. I feel so much better. Let me handle my business. You'll start gradually seeing. So my passion lies between healing yourself and knowing that you already healed. But you never know that because you're so suppressed by so much chemical. You know what I'm saying? So try to find cannabis, even if it's CBD. And that's what's going to help. Because a lot of us, we don't know. We don't even know where to start. We don't even know where to go. And our mental is so messed up. You know, our state of mind is so messed up. We don't trust no doctors. I don't trust to go to the hospital and they're going to help me. I cut myself so deep the other day. I'm a chef, y'all. I cut myself so deep. I know I hit a tendon, a nerve, and everything. I'm driving to the hospital, y'all. Listen to me. I'm driving. And my spirit say, bro, go home and heal yourself. You're not gonna need them. They're not gonna be able to do nothing for you. Here in my mind, I'm like, bro, but I got sickle. These are the talks that I have with myself. Bro, I got sickle cell. What if this gets infected? If anything happens further for this, it could be a problem for me. Bro, go home and heal yourself up. They're not finna do nothing for you but stress you out. We shouldn't be having talks like that with ourselves. You know,
I agree.
there should be a compassion. There should be a alert. Why go through all this training and studying to become a doctor to help and heal people if that's not what you're doing?
Right.
Yeah. And I will say, you know, a lot of the training in medicine and nursing, it's not culturally comprehensive in any way. You know, a lot of things we're taught is everybody is the same, but we're not the same. Like, we are not the same. With sickle cell disease, another component that happens is sometimes you need oxygen support, right? Because the blood cell can't carry it. There was just a study that came out in a journal that popped on my door this week. Non-white people with more melanin in their skin, their oxygen saturation, the thing that goes on your finger, reads differently. Melanin makes it look higher than it actually is. So if we're both in the hospital, or all three of us are in the hospital, and all three of us are 94%, my 94% is probably real, probably because these technologies were mostly tested on, you know, exactly. Again, with the systemic racism, again, they were probably all done on white people, right? Yeah, exactly. So I'll read 94. So that if I'm saying, oh, I can't breathe, my 94 is true. And the doctors can say, you have anxiety, you're going to be okay. Your 94 might actually be a 90% to 89%. That's bad. So normal is anything above 94. We start getting 92 is okay, 90, 89, 80, bad. Like, you don't want that. You need oxygen support, right? We saw this in COVID, you know, who dies from COVID, who doesn't, you know, that oxygen reading means a lot. So we have to learn competent healthcare for everyone. And so what is one thing we can do to fix that? That seems like a bigger answer, but could actually be a smaller answer. So we absolutely need to diversify healthcare. And I know that is not an easy task. Working in healthcare, you know, medical school admissions, significantly harder if you don't have a doctor in the family, right? You know, it's hard to figure it out. It's hard to figure it out without support. But, you know, if you're interested in science and you have family members, and, you know, you are, you know, essentially not a white person, please go into medicine and nursing. We absolutely need you, because just like with the mortality rate in Black women, like, it is a shame. And there is no amount of money that saves Black women from dying in the hospital. 1 in 6 Black women will have a terrible maternity outcome. If you have something like a chronic illness like sickle cell, your chances get even worse. And it's because of this implicit bias. We could do implicit bias training right now for people. We need it in nursing and medical school. So yes, if you are in the Black, Latinx, Indigenous community, Indian, please go become a healthcare worker, because I see it. You know, it's unfortunate, but there's just an initial understanding of what somebody's going through. So, you know, I always support anyone I see who's like, I want to get into nursing. I'm like, good, go. What can I do to help? Can I write your letter? Anything. And then implicit bias training, because there is implicit bias in treating pain, and the Black community is not treated fairly in a lot of cases. I have been fortunate enough to work in the Chicagoland area. So luckily, a lot of my colleagues are empathetic, and, you know, they don't have this shitty, sorry, I hope I don't get us in trouble, racial bias that, you know, folks in rural areas have, or other states. We still see our problem people here. And I have visited hospitals that, you know, are not in, you know, huge city areas where they're not used to seeing anybody, but people who look like them. And that's where it's bad, because they don't even know how ignorant they are. And that's a huge problem. So sorry, I'm really passionate about that.
No. I know, because I'm on my phone, I haven't been able to see the comments. I know we're over an hour, but I wanted to see if Simona could pop on and like give folks an opportunity if they wanted to come on, ask questions, share their story, share anything. Are you feeling anything that someone has said, or feel like you need clarity on something? I mean, we obviously are all very passionate about this conversation and really want to be able to, I mean, even are thinking about like how we can have another conversation sometime this month, just because there are so many topics that we didn't get a chance to cover. But I also wanted to give Demetrius an opportunity to talk about his music, because I thought that was a really interesting way to, to take your passion. I mean, we all know there are different artists that have personal stories that they use and they share through their music. And Demetrius has a whole album where he talks about cannabis over prescriptions, right?
Absolutely. Yeah, cannabis over prescriptions, the healing. And literally, what it's dedicated towards is me overcoming 180 milligrams of opioids and what things helped me. So the song titles are from the things that helped me on the journey, because it's it's not a day process, it's not a week process, it's long nights of suffering, but you grow. You have to. Music for me has been what people go to counselors for, therapy. With all this trauma and sickle cell that's dealt me, the studio and releasing and being able to write a song, that's my therapy. That's my counseling session. So when I log in and I'm locked in at the studio, I compress real diamonds. It's like, because it's my life story, and I wanted to make it sound cool to where I could listen to it, where another person that's going through the same thing be like, damn, bro made that sound so good. It don't even sound like pain. You know what I'm saying? Like, yeah, but I go through that. So that's what cannabis over prescriptions, the healing is. That's what all of my music is. My life story. And a song on there called RSO. I told y'all about that. It's called Rare Soldier Oil, RSO.
What is RSO? What is RSO?
RSO is Rick Simpson oil, and it's pure cannabis extract. It's derived from the cannabis plant, and it's compressed all the way into oil form. Now it's very potent, and Rick Simpson discovered it because his mother was going through some cancer issues, and she couldn't smoke cannabis, and he used that to help heal her. So it's very effective. It healed me. I researched it. It's definitely got me off so many nighttime opioids that I was taking at night just to help me go to sleep. Very potent. It's natural. And on my cut, I rubbed RSO on that when I got home and said, bro, go take care of yourself. I rubbed some RSO on that, put a little Band-Aid on it, stopped the throbbing, stopped all the pain, all of that stuff. So
wow.
You just have to understand that these natural medications is what it is. And from my music standpoint, that's what I tell people. RSO, lemongrass on there, which is a form of herbal tea that I drink. Smoothies in the studio. That's what the album starts with. That's the introduction song. Smoothies in the studio. When the song come on, it just paint a picture of me. You could just hear the jungle and the birds. It's just about growing and just shedding skin and just leaving behind all those milligrams of opioids and all that hurt and pain. To now, I feel like I got my wings. And it's a beautiful project. I love for you to go check it out. There's songs on there called Battling, Crazy. Man, it's just top to bottom. Cry No More. On Cry No More is the outro of the album. I just talk about all my sickle cell patients that I loved and known to come across with this advocacy life. And they passed away, and I shouted out their names. So I got a new album coming up too, and it's called Soldier Shit. It's talking about sickle cell and how you can overcome all these pains that you live with, letting you know that you're a supernatural soldier, how to be your own doctor. Absolutely. So just tap in with my music. There's healing vibrations there. I also learned that sound therapy is another form of medicine. And that's what I use my music to. So everything that I do with my music now is a vibration. I'm learning to use more instrumentations that's going to calm the frequency down in the body, to give the mind certain ways that it can, you know what I'm saying, heal. uh just talking about this is passionate, man. I could cry because we go through so much, and I cry when I'm in the studio. My engineers and my producers, they see me vulnerable because they know I'm turning this pain, I'm writing it on words, and I'm getting it out, and that's my therapy. And they could see me healing, they see me shining, and it's just a beautiful thing, man. I don't do all this for money. I do all this to help people heal themselves. I like to share my story because when I was sick in the hospital as a kid, teenager, I look online and nobody looked like me that had sickle cell. Nobody was telling their story. There was no artist that was talking about sickle cell rapping. I could look at no interviews. All the interviews I started looking at was Dr. Sebi, Bob Marley. I started watching people that learn to heal themselves, the indigenous people, and all of that stuff is what got into me. Vibrations from Tupac Shakur, his poetry, and just his struggle and his fight. And I also wanted to let folks know, man, Kirk Franklin also helped me too, inspire me with a lot of my pain. And man, music is a vibration that's going to heal the body naturally, and that's a medication for the world. So that's another alternative that I like to give my sickle cell patients. Let them know this is that good pain music. This that good pain medicine. You can go ahead, and relax on this one. You know what I'm saying? So
Yes.
check
Well,
me out, tap in with me. I love all my soldiers, man. Sickle cell
yeah.
is near and dear to me. I love sickle cell more than anything, and it's the most precious thing in my life. So I
And
do.
thank you for sharing that with everyone. I mean, you
Absolutely.
talk about vulnerability, but thank you for sharing that with everyone,
Most definitely.
um, because it can be inspiring to others. Um, and Rebecca, I wanted to give you a chance to have some last words. You talked a little bit about the impetus for you starting 420 Chronic.
Acuteunchronic.com. Yes.
Yes, yes, yes.
That's okay. So yeah, I noticed, people needed guidance, people needed help. Nobody in the healthcare industry knew what to say because we're not taught it, and nobody had the motivation to learn because it's this very gray area, right? Doctors would say, just go to the dispensary, but the folks at the dispensary, they don't really know either. They know the products, they know what the marketing people tell them to say, but they don't know the science, because there are some drug interactions with cannabis that we have to be careful of. There is a right dose for everyone, and it does take time to figure it out. So that's what we do for you. We assess you. We take into consideration your whole life. We assess the whole person. What's your personality? What are your past medical history? Tell us everything about you. We create a tailored care plan for you. We recommend products, dosing ranges, and then we say, okay, patient, here are the 5 to 6 things we recommend. You could try all of them. You could try one. It's your choice. That gives the power back to the patient, because if you're watching this and you've been chronically ill with chronic pain, you know that a lot of your autonomy is oftentimes taken away. And so what's great about cannabis is we'll guide you, but we give you your autonomy back. You work with us more with titration techniques, so that's going up or down or changing what we're using. We eventually find the right amount of cannabis and what products we should be using. Usually that takes about 4 to 8 appointments. We have about a 90% success rate so far. If you go to the dispensary and tried that, you have about a 20 to 25% success rate. So that's what we do. You could find us. This in the window is my Instagram. You could go to our website, www.acuteunchronic.com. Our TikTok, where you could find more education, hopefully building soon, is Acute Chronic RN. And then please, yes, we'll talk to your doctors, have your doctors call us. We are trying to do more research. We've been published twice now with helping people with pain and other symptoms like anxiety, agitation, so on and so forth. We help people with over 30 disease processes and symptoms. We are a nationwide company, so no matter where you are in the United States, remember CBD and CBG are legal everywhere.
Yes.
We can help you, and we can help you find access. We can help you get a card. Our 2 physicians are wonderful and from academic medicine. And when other doctors hear that our doctors are from highly acclaimed institutions, medicine's a hierarchy, they listen to us. So we will do all of that for you. So that's us. And yeah, we really want to be a support, an advocate, and help people get access to cannabis the right way.
Yes, and that is amazing. Because and the fact that you got published, I mean, that is what people in the medical community respect. They want to know, where's the precedent, where's the research, where can I read about it? So please continue to do what you're doing. Also, Demetrius, thank you for coming. Continue to advocate the way
Thank
that you have been. I wanted to make a couple shout outs to some other folks that have been joining us, and also are doing some great work. Cannabis Nurses of Color, who are also a Rooted in Good partner. And I believe Simona told me that like I can't see the comments, but there's been like a really good chat going on. Frank and Penny, Jasmine, who's my cousin. Hey, Jazzy. And Dr. Holden. And we absolutely thank you guys for joining this conversation and for staying and listening. I hope it was therapeutic for those that are patients and that people learned something. I also want to make a plug for Tetragram app, which is a Black-owned company here in Maryland that is also helping people to determine what type of products they need and like from the dispensary. And also thank you to Cureleaf and Rooted in Good program for supporting these types of conversations and helping to move the needle forward for equity. I mean, there are so many things we didn't talk about, but we covered a lot. So I'm excited to be able to replay this. We're going to have it on our podcast. It's going to live on our YouTube, Marijuana Matters, and also on our website. But thank you guys so much for coming and sharing, and thank you for listening. Bye.